Is your vagina sore? Is it itchy? Are you embarrassed every time you try and squeeze in a little scratch, hoping that no one sees you? And now you've noticed this white, creamy discharge. And sometimes it hurts to urinate and it's painful when you have sex. Well, my friend, you may have thrush. Hi, my name is Dr. Naomi Cave and welcome to Know Her. In today's video, we're going to be talking about thrush. If you have any topics you'd like me to discuss in a future video, put your comments down below and we'll get to it. So what actually causes thrush? First of all, I'd like to say thrush is not an STI, but it can be transmitted through sex. Thrush is caused by a fungus called Candida. It's usually harmless, but when it overgrows, it causes problems. And boy, does it cause problems. Itching being one of the most common signs. Our bodies have many microorganisms living inside peacefully in a lovely, balanced ecosystem. And they're all kind of having this lovely ecosystem where they are just all happily keeping each other in check. It's when the conditions change that things hit the fan. So it could be hormonal changes. So people have noticed that when they become pregnant, they may be more susceptible to thrush. If you've taken antibiotics, some of the bacteria that were in your body keeping the fungus in check have gone, so you may get thrush. If you have a poor or weakened immune system, so let's say you have HIV or you're on chemotherapy, that could also increase the likelihood that you have thrush. Thrush isn't caused by bad hygiene. In fact, overly washing, douching, using scented products can exacerbate thrush. It's more like the more hygienic you are, the more you want to control the scent of your vagina, the more it's going to be upset with you. So it's not about hygiene. The good thing about thrush is you don't always need to test it to diagnose it. Usually the clinical signs are good enough for you to get treatment, and you can get treatment over the counter. There are 3 types of treatment you can use for thrush. The first line is fluconazole. This is an oral tablet. However, some women, especially pregnant women, can't use this tablet. So normally there's Canesten in the UK, which is clotrimazole. You can have a cream that you can apply on the vulva, and you can also have a pessary, which can be inserted into the vagina. This is also a pill, but rather than going into your mouth, it goes into your vagina. It's advised that you do this at night because it can get a bit messy during the day. It's reasonable to assume that you have thrush if you have itching, if you have discharge that is creamy, white, and some people have described it as a cottage cheese-like consistency, and also the discharge doesn't smell and is not discoloured. It's also reasonable to assume you have thrush if you are, let's say you have pain when you're urinating, but you don't have other signs like needing to go more frequently or having the feeling of urgency, and if you don't find a bathroom this very minute, you will wet yourself. That's not usual for thrush, but if you're just having the sensation that it's a bit sore and painful when you're urinating, plus the itching, plus the discharge, then it's reasonable to think you have thrush. It is also reasonable to assume you have thrush if you have the above following symptoms and you have no changes to your bleeding. So no bleeding in between periods, no bleeding after sex. Whilst it's great that we can get over-the-counter treatment for thrush, I would always just suggest that if you are ever in doubt, go to your healthcare provider and seek further advice. It's also important to note that the creams and the pessaries can affect the latex in condoms and also your diaphragm. So if you're using these as your main source of contraception, I would suggest that whilst you're using the treatment and several days after, abstain or find another contraception that you can use. Firstly, let's talk about clothing. Wear nice, loose-fitting clothes. Use natural fibres, cotton is your best friend, and get rid of synthetic fibres. When you wash things like your knickers, use non-biological products and avoid using fabric conditioners. Alternatively, just go commando for a bit. Just let your vagina be. It's just the best organ ever. And the less you do to it, the better and happier it will be. So let it be. Avoid using scented products around the vagina. So soaps, perfumes, having even bubble baths can cause irritation. Every day I would use unscented soap and a non-fragrant moisturiser around the mons pubis, the skin around the vagina, and don't use anything in the actual vagina except water. I use Vaseline. I tell a lie, I use petroleum jelly, I use the knockoff stuff, and I use it every day as a moisturiser, and I have not had any problems, so that's some food for thought. Whilst it is not a sexually transmitted infection, when you have sex and there's a lot of friction, it can encourage the overgrowth of candida. So I would suggest make sure you're well lubricated, use a good lube, and enjoy sex. You shouldn't be having so much friction. That sounds painful. So when should you seek medical advice when you think you have thrush? My personal opinion is anytime you are worried and concerned, it's okay to seek advice from your healthcare provider. They can either give you reassurance or they can treat you for what you really have. But it's especially important if you are under the age of 16, if you've already treated thrush over the counter and you're still having the same problems, or if you've had thrush twice in the last 6 months. Also, if you have any abnormal bleeding, you are having abdominal pain, if there are changes to your urine habits, so increased frequency or increased urgency, if you're feeling unwell in yourself and you also have vaginal symptoms, if your discharge is discoloured or there's a bad smell, if you have HIV, if you're on chemotherapy, you're using steroids. Lastly, if you notice any rash or blisters on your vulva or your vagina, then definitely seek medical advice. Alright guys, I hope you enjoyed this video. If you're enjoying this content, make sure to like and subscribe. It really helps me out. Thank you again for watching and have a wonderful day.